Yellow clothes. Yellow clothes. If you're from Nigeria or you stay in Nigeria, you must have heard these things as often as possible, especially if you just gave birth to your baby. You'll be told to avoid yellow clothes or anything that is yellow around your baby, because yellow clothes or anything that is yellow, be it the clothes, the blanket, anything at all, yellow socks, anything that is just yellow. Anytime you bring it close to a newborn, it can cause them jaundice. So we're going to be talking about these things in this video. So if you are new here, welcome to this channel. And this is first time on this channel, we discuss health for new and expectant moms and health for babies. If it's something you're interested in, join the family and let's dive right into today's video. So in today's video, we're talking about yellow clothes and jaundice. Some of these things sound logical. So there's this, oh, since jaundice will make the baby's skin yellow, will make the eyes yellow. So anything that has to do with yellow, be it the clothes, be it the blanket, anything at all should not come close to baby. But it's important we know what jaundice really is. We should know what is really causing a jaundice before we now talk about what clothes baby is wearing, whether it is yellow or any other color may result in jaundice. So really, what is jaundice? When it comes to jaundice, jaundice can be very common in newborns. It can be scary. It's a condition in which the baby's eyes, the baby's skin, they appear yellow. If you just give birth to your baby or you're expecting a newborn, I've not watched that video on this channel that talks about signs to look out for in your newborn. You should watch that video. When it comes to jaundice, jaundice is one condition that can arise in newborns. So like I said initially, the eyes may appear yellow, the skin may appear yellow. However, this thing is happening because there's an accumulation of a particular substance in the baby's body, and this substance is called bilirubin. This substance gets accumulated, and one of the major roles of the liver is to help the body clear up this substance. But in newborns, the liver is still maturing. The liver is not as mature as what you will see in older children or in adults. So it tends to accumulate. And before you know it, the eyes are becoming yellow, the skin is becoming yellow. Like I often say, there are two types of jaundice. There's the type that is harmless, there's the type that is very dangerous for the baby's body. As a parent or as a caregiver, you may never know which one the baby has. That is why anytime the baby's eyes are yellow, anytime the skin is appearing yellow, it's important that baby is examined by the doctor to know which type it is, because oftentimes if it's the harmless type, the baby will do just fine. That's why you hear things like, oh, I gave papa water, I gave this at home, it will work, my baby's jaundice just cleared up. It's important to know that there are different types of jaundice, and in some cases, the home remedy you may think you're banking on will not work. And when it even comes to the home remedies, it's not because the home remedies are actually working per se. It's just that this jaundice is a harmless type that usually just go away on its own. By just feeding your baby, by breastfeeding your baby adequately, this type of harmless jaundice will usually go away. That type of jaundice would have still gone away if you didn't even give any of these home remedies. By just feeding your baby, it is a harmless type. This harmless type will usually go away on its own. However, there's this type of jaundice that can be very dangerous. There's a type that the baby will need treatment, the baby will need to be examined properly, the baby will need to be monitored closely, because it can be dangerous for the baby's brain. That is why anytime you notice jaundice in your baby, do not just risk it or gamble with your baby's life or gamble with your baby's health, because the complications can be irreversible. Because when it gets to the brain, it can cause a lot of complications. You can have things like cerebral palsy, and these are things that are irreversible. So when it comes to jaundice, anytime you notice jaundice, it's important that baby is examined as early as possible. So like I mentioned initially, the baby's skin is appearing yellow. So this yellow appearance of the skin and the eyes is due to what is happening inside the baby's body. So when it comes to putting on yellow clothes for your baby, or wrapping them in any material or fabric that is yellow, or using anything that is yellow around them, it will not cause the baby jaundice. It's just a myth. People just believe that because the eyes and the skin are yellow, anything that has to do with yellow can actually cause the jaundice. No. Whatever is causing the jaundice actually happening from inside the baby's body, and not what your baby is wearing or putting on per time. There are other people who will tell you, okay, I believe that it doesn't cause the jaundice, but it can reflect on the baby's skin, and all of a sudden the baby is appearing yellow. You may have a point there. However, to be sure whether a baby has jaundice or not, anytime you suspect suspecting that the baby has jaundice, the best you can do for that child is that jaundice level should be checked. That's the bilirubin, that's the substance in that baby's body causing the yellowness of the eyes or causing the yellowness of the skin be suspected. So at any point in time you're suspecting that this baby is having jaundice, and whether your mind is telling you, oh, is this clone that is reflecting on my baby's body, or you're just suspecting, ensure you get that baby examined, that baby is checked by the doctor, that baby is tested, their blood will be tested to know the level of that substance in their blood. Because if that level of that substance in their blood is not known, you can never tell for sure whether your baby is having jaundice or not. Because sometimes you may be suspecting and you're just confused, and before you know it, if it really has jaundice and you've not measured the levels, that will be putting the baby at so much risk. It's better you err on the side of caution. Do not just say, oh, I'm suspecting, so I'll stop using yellow clothes for my baby. No, at any point in time, your mind is telling you, that particular part of your mind is telling you baby has jaundice. It's not about the clothes your baby is wearing. Ensure that baby is tested, ensure their blood is tested to know the level of that substance in their blood. Until you know the level of the substance in their blood, until you know the type of jaundice baby has, you can never tell for sure whether baby has jaundice or not. So do not just stay at home and be guessing, or stay at home and say, okay, I'll try this remedy. Many babies have been kept at home for days, for weeks, and before you know it, the complications became irreversible. So as much as possible, get your baby tested. Like I mentioned initially, there are 2 types. You have the harmless, or for the one that is really harmful, baby will need adequate treatment for that chemical substance to be cleared from their body. So as much as you can, be safe out there. So I hope this video has been helpful, and I hope to see you in the next video. And until then, bye.